Welcome back to the Medical Monday edition of Great Day St. Louis. At any age, we can experience balance problems, and it's certainly not uncommon. But what causes it, and more importantly, how do we fix it? Today, we are happy to have Beth Hall with us. She is a master of physical therapy with Apex Network Physical Therapy. She's joining us this morning with some answers. Good morning to you.
Good morning.
So, Beth, I want to start off asking you a question, and it's a question I've never asked before because I really don't know what it means. So here we go. What is the vestibular system?
So the vestibular system is actually composed of three different things. So it relies on feedback from your eyes and from your inner ear and then from the receptors in your joints. So whenever we get information to the brain from those three systems, if there's a mismatch in that information from one party or the other, then you can end up with symptoms that we'll talk about a little bit more, but dizziness and imbalance are usually the primary culprits. So
before we get to the symptoms, let's talk about some of the signs that people have whenever there is a dysfunction in this system.
Sure. Probably the thing that we hear most often is patients will roll over in the morning and they'll feel like the room is spinning. So it can be very severe and debilitating, and they usually feel somewhat nauseated. And it's so severe that sometimes they miss work or miss school, and can result in falls and so on and so forth because they're so off balance that even attempts at sitting upright can sometimes be difficult.
And that has to be terrifying if you wake up one morning and all of a sudden everything is spinning and you're totally off balance.
Right.
So then they contact you guys. How does physical therapy help with this?
So the physical therapists with Apex Network Physical Therapy are trained specifically in vestibular rehab. And so a lot of the things that we do also incorporates traditional physical therapy. So when a patient comes to us, we'll look at their strength and balance and coordination, range of motion and flexibility. But we also have equipment. It's called this video nystagmography, and that's a mouthful, so we just say VNG.
Makes sense.
And so we have some of the equipment with us today, but it includes a battery of 18 tests, and it has a balance platform that they'll be standing on here in a second. You can see. And they'll lean in different directions on that so we can see if they have a deficit in one direction or another. And then we also have goggles that we'll use to check the eye reflexes. And so we'll see it's called nystagmus. It's a rapid beating of the eye if there's a problem with the inner ear. So it gives us feedback about that also. And we have calorics, which is blowing warm or cool air into the ear. And that will help us determine if it's a problem with the right ear or the left ear. So then we can use all of that information then to develop a pretty individualized treatment program for each person. And then using traditional physical therapy, we can also use the balance platform to treat them. And then we try to work toward whatever their deficits are, whatever their specific needs are. So if they're having trouble with return to work or return to sports or falls, and falls is really a particular problem, especially like in our elderly population, because about 10% of all falls result in really serious injuries like head trauma or fractures. And the mortality rate is so high for, say, hip fractures. 5% of people who are hospitalized for a hip fracture will die while they're hospitalized. And even in that year following, the mortality rate is still up to 58% following that first year after their fracture. So vestibular rehab is super important because it's been shown to reduce fall rates 30 to 40%. So we can definitely improve their quality of life and their independence, especially in that older population.
Absolutely. It makes sense and fascinating work. I just never thought about balance going into physical therapy. That's amazing. And I'm sure many of you at home are thinking, okay, I want to find out much more about this. So to find a therapist near you, check out their website, apexnetworkpt.com, or you can call them at the phone number on your screen. It is 618-288-4233. Matt, I think this is really fascinating technology.
I do too. And is it weird that as I watched our model there demonstrate that I was paying really close attention to how my weight's distributed and how my balance is? That's cool. Neat technology. Thank you, ladies, very much. Still ahead here on this Medical Monday edition of Great Day.